Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and today we will talk about endoscopic surgery in gynecology. We divided our lecture topic into 5 sections. In the first section, we will talk about history of laparoscopic surgery and then what are advantages and disadvantages of the laparoscopic surgery. And then what are different instruments used in the laparoscopic surgery and what's the electrosurgical units. Then in the next section, we will talk about how we can achieve hemostasis during the laparoscopic surgery, what are the indications used for laparoscopic surgery, and what are some contraindications and complications. Then in the third section, we will talk about tubal sterilization with single puncture, total laparoscopic hysterectomy, and then laparoscopic assisted vaginal hysterectomy. In the fourth section, we will talk about hysteroscopic procedures, what is diagnostic and operative hysteroscopy, and then levels of hysteroscopic procedures. In the final and fifth section, we will talk about operative hysteroscopy, in which we will talk about hysteroscopic myomectomy and what are contraindications and complications of hysteroscopy. So this will be all we will talk about in this lecture. So hopefully you are interested to learn more about endoscopic surgery in gynecology. So keep watching sqadia.com to learn more about this topic.